Thank you for joining us today. I was reading a really interesting article on the CDC website last week, and it said that for the first time in over a decade, emergency departments across the nation are seeing the most hospitalizations from tick bites. What are you guys seeing at Ohio Health? Did you find this new study alarming?
Yeah, it's definitely come earlier than we've traditionally seen. Typically, we start to see that spike come in early summer and certainly late summer months, but we are starting to see a trend, especially in the upper Midwest and the Northeast, and certainly at Ohio Health with more ER visits, not quite hospitalizations, but I think starting to see tick-borne illnesses as well. And we think this is probably multifactorial. People are starting to head out into the warm weather and so get more exposures, but also these milder winters have probably led to a higher prevalence because these ticks are surviving since we're not hitting some of those freezing temperatures.
Yeah, and I mean, a lot of times when people, are bit by a tick, they just pluck it out and go about their day. When somebody shows up to the office with a tick bite, what determines kind of the course of action between do you treat for it, do you monitor it, do you test? What is the thought process behind that?
Yeah, that's a great question. I think it's important to call out that not every tick bite leads to an illness in humans. Remember that ticks are vectors in that way. They can carry bacterial and parasitic and viral infections. And the one that we certainly are most concerned about, at least here in Ohio, is Lyme disease. But typically, for a tick to transmit disease to a human, you have to see you have to estimate about at least 36 hours, give or take, for an illness to be transmitted. So, my first message is don't panic if you've gotten bit by a tick. The first thing is to remove it carefully if you can with fine tip tweezers as close to the skin, and pull straight out. Don't do a twisting motion. You want to get the mouth parts, and then wash the area with soap and water. If you can inspect the tick and even keep it for show and tell, that can be helpful, but you want to see if it's engorged or not. And if you can estimate how long you think you were exposed. Again, 36 hours is more typical for disease to be transmitted. And that's why prompt removal and seeking um, uh, um, primary care or some kind of medical attention is important if you are concerned that you've had exposure for greater than 36 hours, or you start to have symptoms such as a bullseye like rash in the area, looks like a target, fevers, headaches, even joint pains. Then you certainly want to seek medical attention, because those can be treated if treated promptly.
Is that treated with an antibiotic? What do you guys use for it?
Correct. Yes, antibiotics.
Okay. And so what are the earliest symptoms that you would like to tell patients about?
Yeah, I think the most important thing, again, is try to pay attention to when you think you had that tick exposure and how long you estimate that the tick was attached to you. And so the biggest things are looking at the site of where the tick bit you, and taking a look and watching your skin. Are there changes in redness? Is it starting to look targetoid in that area? Do you feel feverish? Do you feel unwell days or even up to weeks after the illness, after the tick bite? And certainly thinking about headaches, joint pains, those things you don't want to ignore, knowing if you had tick exposure. And even in patients who don't necessarily identify the tick or know for sure that they were bitten, if you are having those symptoms, please do seek medical attention.
Is there anything else you think people need to know and remember when they're maybe heading out on a hike or just enjoying the outdoors this spring and summer?
Absolutely. We don't want to keep people from going out into the warmer weather and enjoying some of these warmer temperatures. But I think just being tick aware is important. There are a lot of simple preventative things folks can do. One of them is making sure that if you are going out on a hike, you're trying to stay in the center of the path and avoid those tall grasses or wooded areas or piles of leaves that the ticks like to hide in. Thinking about what you're wearing. So if you can, wearing long sleeve shirts, long pants, thinking about tucking your shirt into your pants, even tucking tucking your pants into your socks. Light colored clothing can also help to identify the ticks a little bit easier. And then really thinking about when you're coming in, doing a full body head to toe tick check. You want to think about the areas that the ticks like to hide in. So behind the ears, in the hair, in the arm creases, behind the knees, in the around the waistline, even the belly button. Don't forget to check your children and your pets because those ticks might like to hitch a ride. And then again, thinking about simple things like insect repellent on exposed skin. You want to have active ingredients such as DEET. You can also buy pre-treated gear if you're camping or things like that that are pre-treated with permethrin. And then think about showering immediately if you're able to. That gives you a moment to really wash off any ticks and do a full body inspection. You can also throw your clothes into high heat in a dryer for 10 minutes, and that should kill the ticks. So those are some simple things and simple measures that people can do while still being able to enjoy the outdoors.
All right. Dr. Joy Walton, internal medicine doctor at OhioHealth. Thank you so much for joining us today.